I am Vernie Smith, and welcome to another edition of Issues in Focus. What a week it has been. Of course, the topical issue of the day still remains healthcare reform. Will we have it? Won't we have it? I don't know. President Obama has been on the ropes all week, all month I should say, trying to convince Congress and others out there, Blue Dog Democrats among others, that healthcare reform, not even mentioning that with a public option, is the way to go. But has he been succeeding at getting that message through? First, I will take a quick short pause to say his last outreach was a press conference held later this week in which he spent 99.5% of the time talking about the various aspects and advantages of turning this rotting system around. He mentioned that the GNP healthcare is about 16 to 17% of the GNP. I remembered years ago when healthcare was about 11% of the GNP, meaning even with this rotten system, it's taking more and more of our money, the nation's money, that should be used to do something else. But that said, at the end of his press conference, 1 hour, someone, a journalist from Chicago, threw up the question on a local issue in Cambridge, Massachusetts, between a local police sergeant and Henry Louis Skipgates, a professor at Harvard University. That story became the lead story. At this time, I'm not going to take one more minute to talk about that because it's a local issue, and I was shocked, mystified at how quickly it became the lead story on all stations and how quickly people who have nothing to do with it started to lay blame. I want to say that is not how it should be, and I understand that the president has invited Skip Gates and Sergeant Crowley to the White House for a beer. Great idea, because his message is being obscured by something that shouldn't be a national issue, and in the process, what are we talking about? So I'm not going to add to that dialogue. It will take care of itself. I hope the sipping beer together at the White House goes well. Mr. President, I like Miller Lite, Budweiser, and when is my invitation coming? So on that note, I will move to what I consider the topical issue of the week, which is healthcare reform. How are we going to have it? Is there going to be a bill? Quickly, I can only say to you that the president was hoping that he would have a bill signed through Congress by the August recess. Senator Ara Reid has come out to say it's not going to happen. So I think all parties have sort of resorted that this will happen in September, when the House reconvenes. Reid promises that there will be an airing before all full House. I don't know what will happen. All I can say that in agreement with the president and someone who has some experience also in healthcare other than in journalism, I know that the system is crumbling. I know that the infrastructure is going. I know that costs are increasing. I know that as we speak, several people have lost their jobs because their bosses or their companies are refusing to pay health care. And I also know that the job losses that we have been seeing, some of them are linked to the cost of health care. So something must be done. Of course, the president is not getting any support from the GOP. We all know that. The GOP has been saying no on everything. But most surprisingly, he's not getting the support of a lot of Blue Dog Democrats in his own party. I am saying that this is the first time in a long time that the Democrats have the executive branch, the president, Congress, the House and the Senate. And what is going to be the excuse if one of his topical issues on his agenda falls through the trapdoor? It's not going to be a good statement for his party, nor for him. So we'll see what happens. But the fight continues. The president is on the ropes. I had a chance to listen to a number of shows over the week. Some are saying that if we have healthcare reform, it will be about rationing, it will be about price control, it will be about less access and quality to healthcare, it will be about the restriction of emerging technologies to make healthcare what it should be in terms of what can be done for a patient, and I'm saying I don't believe that. But there are two sides to the issue. What is your side? What do you think? 72% of Americans have said they want healthcare reform and they want competition in terms of a public option to be available to persons. 47 million Americans are uninsured. How long can we as a nation continue with that as we talk domestic agenda, as we talk getting out of this economic recession, as we talk looking to a future where all Americans can be a part of it and talk the American dream? I want to hear your viewpoints, whether they are pro or for the issue, whether you feel, what do you feel about it? Share your ideas with me. And of course, visit my blog. Leave a comment on my blog at vernasmith.com. vernasmith.com, that is my blog. Leave a comment on this video. I would love to hear your points of view, because I really believe the time is right for this legislation. It has to be now. As the President said, it will be done in stages. It must be done in stages. Review, control, move on to the next level. But to do nothing after so many years, when people who have worked in the industry, who know it well, know that it cannot continue like that, as I said, I'm surprised. So for me, that is the topical, most important issue for this week. The President is in trouble, and so is healthcare reform. Are you ready to accept that? Now, having said that, I want to move on to Governor Sanford. That's my human feature for the week. He's on his way out of the country on a vacation, and it's most surprising that at this stage of the game, as I said in a previous video, I wouldn't judge him. I don't want to judge him. But he was asked at the airport, you know, about his going on vacation this time with his wife Jenny and their 4 sons. And I will only summarize by saying he gave an answer that he's going on this vacation is about putting the genie back into the bottle. I find that to be so laughable. But I'm not going to judge the governor. You know, we're human beings. He's a GOP. I am not. But that doesn't mean that he doesn't have a right to, you know, making a mistake. But what kind of answer is that? Putting a genie back into the bottle? So unlike the other issues that are consuming our time, is polarizing the nation because it's about race, I'm going to leave that out of my picture. So again, the topic is healthcare, 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 healthcare. Healthcare reform. There's no other way for me to end this video than to say what should be happening. What should you be doing? Should you be contacting one of those senators from the Blue Dog states? Have you contributed to their election? Have you contributed to their being in office? Should you call them up personally, not speak to a staff person and say, Mr. Senator, this is what I want and I'm looking for your support because I was among so many others who got you elected to Congress. What about what we want? So again, the barriers are up, the doubts are up about healthcare reform. At this stage, no one knows exactly what will happen, but at least what we do know, it won't happen before the Congress goes on recess in August. Share your points of view. Tell me what you think. Are we to shout louder? Are more of us need to take to the streets to say, you know, we have concerns, we can't pay our bills, and healthcare and what is taking out of the nation cannot continue? As I said, leave me a comment on this video. Visit my blog, vernasmith.com. Join the conversation. I would love to hear from you. Again, this has been Verna Smith. This has been Issues in Focus. Look forward to talking with you next week. Have a good week. Bye-bye.